Our next speaker at this time is Dr. Jeff Levin. Dr. Levin is an epidemiologist by training. He holds a distinguished chair at Baylor University, where he is University Professor of Epidemiology and Population Health and Director of the Program on Religion and Population Health at the Institute for Studies of Religion. Dr. Levin was the first scientist to systematically review the empirical literature on religion and health, and was the first scientist funded by the NIH to conduct research on the topic. He has authored or edited over 160 publications and books, including his most recent Judaism and Health and Healing to All Their Flesh, Jewish and Christian Perspective on Spirituality, Theology, and Health. Kindly, warmly, please welcome Dr. Levin.
Thank you so much. I'm just so honored to be here. This is really exciting. As I was telling some folks before lunch, I speak a lot and have for 20, 25 years on this topic, especially to medical audiences. And it's so nice to be at a meeting where you don't have to spend the first 20 minutes of the talk kind of justifying spirituality or tiptoeing around it. You can just get right to it. And well, so what in the world is an epidemiologist of all things studying healing or energy healers? Well, actually, there's a kind of backstory to this. Besides the words that were in the bio that introduced me, I kind of have this secret double life. I guess it's not secret anymore. This is being broadcast on the internet. So, but I have a great interest in healing and on healers and energy healing. I come from kind of a lineage of healers. My mother has been a healing channel and therapist for many years. I myself practice Reiki healing, just kind of my wife, our pets, and things like that. I've studied many types of healing. I've probably been an end user, if that's a word. I've probably had one session of just about everything that there is to have. Also, in the years before I was at Baylor, I am a past president of an organization no longer with us, unfortunately, called ISEAM, the International Society for the Study of Subtle Energies and Energy Medicine. I was one of the very first presidents about 15 years ago. I was the first outsider brought into the organization. It wasn't a veteran of the field of psychology or biofeedback. At any rate, this is an opportunity for me to kind of, for want of a better phrase, kind of come out of the closet with these interests. So yes, I do real epidemiology, and my wife is an epidemiologist. We're a two epidemiologist family, and she was trained at the CDC in Atlanta, and I was trained in Texas. But besides that, I also study healing. And there's kind of a funny story about this. For many, many years, I was one of the very first people to empirically study the relationship between religion and spirituality and health. I've been doing this work for about 30 years. And as kind of my name grew, there would be lots of media. And I would do lots of media. I would be referred to as somebody who was studying healing. And I would always protest. I've never studied healing. I don't study faith healing. I study epidemiologic studies. I study population rates of morbidity and mortality, things like that. I've never studied healers. And invariably people would say, okay, that's all well and good. Tell us about your study of faith healers. And I kept saying, but I never study this. Well, finally, a number of friends of mine said, Jeff, maybe this is a sign you're supposed to be doing this. So finally, a few years ago, through my own guidance, through meditation and other means that may be familiar to people at this meeting, I started to get guidance that, you know what, maybe I ought to focus my energy on healers and healing. Since it's a passion of mine, I do it, I receive it, I'm interested in it. And so for the last few years, I've begun cranking out a series of papers published in alternative medicine journals and religious journals on this large topic of healing and healers. I've enjoyed it so much that I just put up on my website in bold letters and italics that I'm no longer accepting speaking invitations to speak on epidemiologic research on religion and health. I've done it enough. So this is now front and center for me. This particular talk is based on a paper that I published in a journal called Explore, which is one of the leading complementary and alternative medicine journals. I published this a couple of years ago. This is a journal edited by my friend Dr. Larry Dawsey. He founded the journal. It's currently edited by Dr. Dean Radin of the Institute of Noetic Sciences, who's a famous parapsychologist that I'm sure some people have heard of. And this is one of a series of papers on healing that I've published in the last few years. And this particular paper was an effort to kind of taxonomize energy healers, kind of take a look at all the various different types of folks out there who say that what they do is healing, or specifically energy healing, kind of step back and take a look at them, who they are and what it is that they do. This was not based on an experiment or an epidemiologic study or anything like that. This is just the result of about 25 or 30 years of having lots of healing and knowing lots of healers and talking to lots of people, and in preparation for this paper, probably reading about 100 books, just about everything I could find in translation about the work of energy healers and what they did, and especially a lot of biographical accounts. So this is what I want to do here in the next half hour or so. Present a little bit of information. When we talk about energy healers, who are these people? How do they kind of organize themselves? Or can we categorize them in some way? And then the second thing, core concepts in energy healing. Really, there should be a question mark. I'm posing the question, are there actually any core concepts, specifically of belief or practice, that are common or universal among all energy healers? And I'll kind of cut to the chase and say, I'll present this. I'm a little dubious about that. I don't know if I'm able to identify core things related to theory or ideology or beliefs and about how healing is practiced that I could truly say the universal among energy healers. So if that's the case, what really does matter for healing if it's not the specific beliefs or the specific practices? And we'll talk about that, what I think really matters for healing. Okay, so the first thing is a kind of a conceptual task, talking about energy healing. And by that I mean, it's just two words. There's healing and there's energy. So what do we mean by healing? Well, as I've perused the literature on this topic, especially the use of the word healing in the medical literature, I found that the word healing is used in three very distinct ways that really don't overlap. There's a sense of healing as an intervention, as a therapeutic modality, a thing, something that's done, delivered by a healer, a practitioner to a client. And there's all kinds of examples of this. There's Reiki and healing touch and bioenergy healing and so on. So healing is something that's done. It's think of it this way, it's an independent variable, or it's an exposure variable, or it's an experimental variable. Then there's the word, then healing is sometimes used as an outcome. As a result of treatment, whether alternative medicine or conventional treatment, one experiences healing. So almost kind of synonymous to words like curing or remission or recovery. Although people distinguish among those words, but the point is it's kind of an outcome. As an outcome of whatever it is that one has being done. It could be surgery, it could be pharmaceuticals, one experiences healing. So that's very different than healing as intervention. And then finally, healing is sometimes used in the literature as a synonym for what the late Israeli sociologist Dr. Aaron Aronofsky, the phrase he used, salutogenesis, kind of the opposite. If there's doctors here who know the word pathogenesis, kind of a cessation or a reversal of the pathogenic, the getting sick process. Salutogenesis is the getting better process. It's moving from a state of disease to a state of renewed health. So healing throughout the many books that I've read, throughout articles published in journals, throughout the textbooks on nursing and medicine and so on, healing is used in all of these different ways. And I'm not here to tell you that what the correct definition of healing is. That's really a different task. I've written papers in recent years about healing in each of these three contexts. What I will say is that for the present talk, we're referring to healing in the first context, healing as an intervention. We'll be talking about people who practice healing and who are self-described as healers. So we're type 1 healing. So healing is an outcome, healing is a process. Very interesting topics. I'm very interested in those, but the focus here is healing as an intervention. The next thing, oops, I got to go back. Energy healing. There's been a discussion the last, I'm going to say 20 years on, I'd call it but is it energy debate? You know, we use this word energy to refer to energy healing. So the question I pose is the energy in energy healing really energy? And this is a fascinating question. I guess the first thing I would say is that I am not a physicist, I am not an engineer, I'm not a philosopher, and in a way I am completely unqualified to weigh in on this topic, and I essentially punt. I surrender to people who know more about this than me, but the gist of this is that this idea of a subtle energy, a bioenergy that's hypothetically part of the bioelectromagnetic spectrum that's perhaps too subtle at the present time for assessment by current instrumentation, although, as I say here, is it? I mean, I don't think that's really true. There have been all sorts of efforts to assess a subtle life force. Another part of this larger critique, healing bioenergy doesn't seem to act like other energies, meaning like kind of the inverse square law. Well, maybe, maybe not. Other people would say that the non-local characteristics of consciousness may better account for what's termed energy healing, whether proximal healing or distant healing, than the word energy healing. Again, as I say, I'm not really the most qualified person to weigh in on this. I would refer you to the works of a variety of other people I've read over the years. Gary Schwartz is certainly one of them, has written prolifically. Jim Oshman, Bill Tiller, Dean Radin, Larry Dawsey, Wayne Jonas, who was one of the early heads of the old also alternative medicine, have all written on this topic. I will say this about it before we move on. To me, this is a very provocative theoretical issue. It's important if we want to understand what I would call the how and the why of energy healing. But for understanding the who and the what, I don't think it's as essential. So I'm not trying to skirt the issue, but for the purpose of what I want to do, the remainder of this talk, whether energy medicine or energy healing is really energy or it's something else, or whether this matters, that's not as germane to this particular discussion than if this were a talk on kind of the scientific mechanisms involved. Okay, so this idea of a taxonomy of energy healing traditions, in my paper on this topic, I identified 4 different categories. There are certainly other energy healing traditions that exist throughout the world, especially in Latin America and in Africa and South Pacific. This idea of this taxonomy is simply my attempt to organize people who practice energy healing into categories that one is likely to find in the United States. The first category I've called East Asian healers. These are some of the energy healing traditions that one finds in the US and in North America that come from East Asia originally. Reiki, Qigong, I think probably a lot of us are familiar with a lot of these shiatsu. Are there any common elements? Well, it seems to me if there's any common elements to be identified, which is not easy, for the most part, these are traditions that seem to be based on Chinese medicine, traditional Chinese medicine. So they, not exclusively, but for the most part, language, what it is that goes on in terms of qi and in terms of meridians or channels. But besides that, there's tremendous diversity. Some of these are based on Buddhist teachings, some are on Taoism, some are secular, some are purely energy techniques, some emphasize body work. Some of them, like Reiki, actually incorporate Ayurvedic features, for example, related to the chakras, which are not part of traditional Chinese medicine, but are part of an Indian tradition, and some borrow features from the martial arts, and some do all of the above, and some do none of the above. A Western professional tradition. By this, I'm referring to those traditions of energy healing that were developed within and for practitioners of Western professional health-related professions, especially nursing. And the most prominent of these are therapeutic touch. I think a lot of us are familiar with. This was developed by Dr. D. Krieger, who was a nursing professor, and Dor Kunz, who was president of the Theosophical Society. It's kind of a modern version of laying on the hands. And being derived in some part from a theosophical underpinning. It's very much grounded in yogic concepts like prana and nadis, which one could think of perhaps, kind of, not exactly, as Indian analogs to chi and meridians, whether they're the same thing or different things or different words for the same thing or not quite the same. Again, that's more of a how and a why question. Healing touch kind of evolved out of therapeutic touch 20-some years ago. Janet Menken developed it. It's another very prominent approach. I think it's a little more eclectic and a little more clinically oriented than therapeutic touch. There's rigorous training and credentialing. There's also been a good deal of published empirical research on healing touch. There's a group of nursing professors, nurse Ph.D. researchers at the University of Texas Health Sciences Center in Houston who've done a good deal of work and have published in peer-reviewed journals on healing touch. Unlike some of the other types of energy healers, these folks, though, have met with considerable resistance and pushback, and some of it really nasty, some of it from the organized skeptic groups like the group PsyCop, I think formerly known as PsyCop. I think a lot of, even the AMA actually, I think a lot of this is very, I would use the word gendered. These healers, for the most part, come from the nursing tradition. They are, for the most part, not exclusively, their early healers were women. And I think there are a lot of a lot of the attacks on therapeutic touch and healing touch are kind of unsavory and are based on the perceived threats of a profession of women doing something and having a positive effect that I think threatens the hegemony of the medical profession. That's just not my take. I don't know if that's all of it, but I think that's part of the resistance they've met. There was a famous paper published in JAMA, the Journal of the AMA, several years ago, purportedly done by, what was it? In fact, Dr. Schwartz might remember the details, by a 9-year-old girl who did some experiment and proved that this is all bosh and there's no such thing as therapeutic touch. Well, it turns out the whole thing was a hoax, and it was co-authored or directed by a de-licensed physician. And at any rate, one thing led to another. Some other unsavory stuff was uncovered at JAMA, and the editor was fired after 25 years, not entirely due to this issue. At any rate, especially related to healing touch, there is indeed good empirical research. And as far as therapeutic touch, there have been probably upwards of 50 Ph.D. dissertations written on the topic. So I would refer people to that. Another category, bioenergy healers. This is a tradition of energy medicine that is of more of Russian and East European origin, goes by many names, bioenergotherapy, bioenergetics, bioenergy therapy, and so on. M.P.H Workus, this is a photo of M.P.H and his wife Margaret, who live and work out of, I think, in Bethesda, last time I was over there. Probably the most well-known and scientifically vetted of all bioenergy practitioners. He's been studied by the NIH and by the United States Army, and there have been articles that have appeared in journals. I published something in Explore a few years ago with somebody trained by M.P.H on the topic of bioenergetic healing. Some bioenergo therapists will recognize a Tibetan lineage, some don't. That's apparently somewhat controversial. But the reference here, rather than to chi or to prana, is to this thing called the bioenergo or bioenergy. And they have a worldview in which the psychological and the energetic and the spiritual components of human life are kind of inseparable with the biochemical and biophysical. And there are a lot of good books on the topic by a lot of Russian and Central and Eastern European healers, a lot of these in translation, and one can find out more about bioenergy practitioners. Then the last category are what I called contemporary metaphysical traditions, metaphysical healers. These are kind of sui generis, unique healers. These are some of the most prominent that I'm familiar with: Barbara Brennan, Donna Eden, Rosalind Breyer, all of whom have written books and have large followings and have trained people. And I don't know that there's a whole lot in common here, although if there is, I would say it's this that might be of interest to this particular group. if there's a lingua franca of what I've called these contemporary metaphysical healers, it's esotericism. It's the language of the esoteric, much as traditional Chinese medicine is the common language for East Asian healers, and theosophy for the therapeutic touch people, and the physical sciences for the bioenergy healers, esotericism. And specifically, these folks are very eclectic, but my experience in receiving healing from a lot of these folks and reading their books, studying them, is that tend to rely more so than the other groups specifically on channeled information from discarnate sources. There's an interaction oftentimes with non-human consciousnesses, and sometimes even languaged as direct conscious assistant from spirit guides or angels or ascended masters or folks like that. I've also identified what I call kind of a sub-tradition, a spiritual healing sub-tradition of metaphysical healers. Now, I'm certainly not saying that everybody who says that what they do is spiritual healing is really a subcategory of a type of energy healer. That's not the case at all. Most of the people that we'll see on TV, the evangelical healers, put your hand on the television screen. These are not people that I think would reference subtle energy or Alice Bailey or anything like that in their work, but rather prayer or faith, or the existence of a God or a Christ who heals people ex nihilo without the mediation of energy and forces and so on. On the other hand, there are indeed some spiritual healers who work probably more outside the mainstream religious traditions, who do recognize the existence of spiritual energies and forces and consciousness and so on that can be accessed and used in healing. And, besides the names I have up here, Ogle Worrell and Harry Edwards and Joel Goldsmith, probably another person that I guess would fit under this category would be John of God. And I suspect there are a lot of people in this crowd who've heard of John of God. And as far as I know, there might even be people here that have worked with John of God or that know him. Anyway, so the next task. There should be a question mark here, are there core concepts in energy healing among all these types of folks? Are there commonalities of theory or practice that all these folks share in common? And this will involve kind of looking at 5 variables. Where the healing comes from, what's the source, and how does it get from wherever it gets to through the healer to the client? What is it that's actually being transmitted? Is it energy? Is it something else? What do healers do when they do their energy healing? What functionally do they do? Is there some type of state of consciousness required? And then the part of the client as well, is there something required? So are there core concepts? Well, let's see. So the first question, the source of healing. Well, like I say, I probably read 100 books on this topic, and when you begin to see what some people have said about this, Stan Krippner talked about implicit or explicit type healing. Larry LeShan talked about the energy healing is due to the intervention of God or spirits. Ogle Worrell said, well, actually, the healer has no power of his own or her own. Other people have talked about channeling sentient external agencies or being a facilitator or a conduit of healing. Janet Quinn said, all healing without exception, that's her quote, is self-healing. So forget about this other stuff. It's all just self-healing. And other people concur with her. Some healers, actually all the healers are doing are teaching the clients or working with them so they can heal themselves, and so on. So right away, we see it won't necessarily be easy to identify a common belief, even as something as fundamental as a source of healing. Next question, what is it that's being transmitted? Is it a current of electrons, an energy field? But then others say, well, no, it's not. It's thought. Or no, it's suggestion. Or actually what the healer is about is not channeling or transmitting anything at all, but just doing work to work on the chakras or the spiritual centers to create a kind of sympathy. And others say, well, what the healing is about is raising awareness. What do healers do? Well, some healers enter an altered state of consciousness. Other folks have said healing actually takes place entirely within the mind of the healer or the practitioner, and then something gets perhaps non-locally transmitted to the client. Others say that really the healer is actually, forget the consciousness, they're actually doing work on the chakras. Others specified this a little more. The ability to channel through the solar plexus and work and diagnose through the throat center. So it's very much about a very skill-based kind of technique rather than just amorphously entering a state of consciousness. What about healers that do healing? Well, Norm Shealy says requires a life of prayer and devotion, and as a result of that, we'll be able to tap into a divine energy source. Swami Panchanasi, we need to, the healer arouses strong mental pictures of restored health and functioning, and then that gets transmitted to the client. Others have said, no, it's about having a neutral mind. It's not holding anything. Leslie Carmack says it's really a dispassion and detachment, and others agree with her. Others have said it's just being open to being a channel for healing. Just keep your will out of it at all. And others have said, yeah, just be spontaneous and no affirmations used at all. And then finally, what about the client? We see a range of ideas from the client's entirely responsible to actually the healer should keep the client focused on their breath, all kinds of stuff. There's an exchange of energy. And then look at the last one here. The attitude of the patient regarding healing does not affect its efficacy. It really actually doesn't matter at all what the client thinks. So to summarize all of this, if possible, it doesn't seem that there are universal core beliefs. And even something as fundamental as the existence of a healing power, of a life energy or a life force that can be accessed and transmitted. Some healers believe that and some don't. And there's certainly diversity in approach from touch healing, non-contact or proximal healing, absent healing. Some folks use their hands. Some folks use a variety of different techniques in assessing or diagnosing. I put heavy quotes around the word diagnostic. A lot of healers have made clear to me that especially in the United States, for statutory and legal reasons, they do not diagnose illness or treat disease. So I understand that. But their assessment techniques vary, and even the extent to which or how they go about accessing whatever higher guidance comes. So in essence, there's a tremendous amount of diversity among energy healing traditions. Many healers are eclectic. I say many, or I put most with a question mark. I can't really say most healers. I haven't met or talked to most healers, but I can say that of the healers that I've met and have known and have worked with and received healing from in my life, most of them are indeed very eclectic. You train in one type of technique, and then maybe you do a workshop in another. Maybe you receive your own spiritual guidance from your own helpers that comes to you, or maybe you throw in some body work. And so most of the healers that I've known are extremely eclectic, and I've just kind of used this word cross-pollination. They draw from different techniques. And this is a wonderful quote here from a friend of mine, Dan Benor. Has anybody ever heard of Dan Benor? Okay, if some hands go up, good. Dr. Dan Benor is a American-born psychiatrist who spent a good portion of his career in England. He is probably, I don't say probably, I'm sure is the leading expert in the world on the scope of published empirical research on energy healing, spiritual healing, faith healing, and all that. He literally wrote the book on summarizing all these various experiments, and that the meme you might have heard that there have been 200 some clinical trials, other types of experimental studies on spiritual healing. This really came from his work, and that was many years ago. I don't know what the number is that we're up to now. I'm sure it's more than 200, but this was a later edition of one of his books. And these are, by the way, it's a wonderful, he has a series of books, a set of, I think there's 3 of them or 4 of them, that are kind of like annotated bibliographies of all the various clinical and experimental and quasi-experimental studies of this type of thing that have ever been done. He's very critical. You know, he reads them with a methodologist's eye. But at any rate, here's a quote. There are obviously many systems of healing, each with its own strengths and weaknesses. Any may be appropriate as an entry into learning to develop one's own healing gifts. The individual practitioners as the vehicles for healing are the most important aspect of whether healings are likely to be helpful, far more important than the methods they use. So I think what Dan is saying is kind of what I would say. It's not that technique doesn't matter, but it's more that the specific technique, certainly technique matters. You know, we can be good healers or bad healers, and whatever technique or system we're trained in or whatever we can do a really great job of it, or we can do a kind of a half, you know what, job of it. We can, I think training is important, experience is important, but I think what he's saying here about technique, that the specific one doesn't matter, that ultimately, people can be trained or do healing through any of a variety of different systems, and they can be successful. So what matters is something other than just the ideology of a particular type of healing system. So if that's the case, then what really matters for healing? So this is the last section of the talk here. What really matters? And these are some fun quotes that I found over the years. This is Barbara Brennan. The heart of healing is not the techniques, but the states of being out of which the techniques arise. And this is Jerry Sulfin, who's a researcher that's done a lot of work, especially in the early days, summarizing existing research on this topic. The common denominator, the golden thread that runs through all forms of healing, may be called the healing relationship, which isn't a single factor. And from Norm Shealy, founder of the American Holistic Medical Association and a inventor of the TENS machine and a Duke-trained neurosurgeon, the elements of personality are most important for healing success are empathy and warmth, sincerity or honesty, and the ability to enhance a positive expectancy on the part of the patient. So the idea is that what really seems to matter is something different than just what technique you trained in or what belief, or do the energies come from here or here, or to use your hands or whatever. Just something different. And I'm going to present now a couple of slides that I think outline what I think is important here. I just want to say that these are not original with me. I'm very grateful for the insights of some of the healers that I've known and have worked with over the years. I think their own quote-unquote clinical observations would reinforce what I'm going to say. Leslie Carmack is one. Laura Mead, who actually I wrote a paper with a few years ago. These are healers that I think would concur with some of these ideas. So here's what I think. Here are three common themes that I think matter in healing and that are a little more universal than just the beliefs or the techniques of healers. Focus, compassion, and intention. So we see here there's kind of these are kind of consonant with the three psychological functions. So there's a kind of a cognitive, mental, intellectual something going on here. Our focus is important, concentration. There's a heart-related aspect, our affect, our emotions, something related to engaging the heart, and then intention, a behavioral or rather a conative aspect. And again, these ideas are not original with me. If you peruse the literature, again, for effective healing, we need clarity of thoughts, a disciplined mind, clear mental image or picture, concentration of the attention, the mind of the healer. Rosalind Briere, the process requires concentration, compassion. From a variety of traditions, what's required is unconditional love. The world said we must care, we must have real compassion. Love will open the way to becoming a healing channel. The old theosophical book, the healing requires creating in oneself and one's heart center, a center of harmony and purity, rhythm, love and compassion. And then finally, intention. Norm Shealy says the intent of the healer is the dominant factor. Another healer said that the idea should be to be a clear and open channel for healing energies, and we must kind of offer them up for the greatest good of the client, their highest good. We need, another person said, a strong field focused on intent. The healer must convince him or herself of must set an intention of spiritual perfection in the patient that can override the patient or the client's own false ideas. And then the Harrison here is Karen Harrison, probably you haven't heard of. Karen was my first Reiki teacher, who I took my initial initiations or attunements, as we call them, and she said, in healing, intention is everything. Well, I don't know if it's everything, but it seems to be very vital. So take-home points now. What seems to make for successful healers? Well, again, some type of a single-pointed focus, an ability to gain a sense of focused stableness of intention. And secondly, ability to have an open heart to other people, to project our compassion, to truly love the people we're working with. to have a sense of empathy, and some would say non-personal loving kindness. Some people who definitely affirm this idea of compassion would say we need to be compassionate but in a dispassionate way. Others would say we need to be compassionate but in a very empathic, not necessarily dispassionate way, but the core here is compassion. And then finally, the idea of setting an intention to help people, to be of service to sentient beings, all sentient beings, or to the client we're working with, or to be helpful or loving to our brothers and sisters. Of all species and life forms. There are certainly healers that work with animals. There also are healers that work with discarnate beings and send healing energy and healing light and love to them as well. And again, besides focus and compassion, it's important to set an intention. Another theme that I find a lot is that all of these things, doing all of these three things, are best nurtured or nourished through having some sort of a regular spiritual practice, whether daily meditation, I try to meditate every day, or I also try to have a regular religious practice. But whatever that is, something that involves going inward and having some sort of introspection, and maybe veterans of the human potential movement would say, something that enables one to kind of step outside of the external mess and to work on yourself. So as long as you've got some sort of regular practice, whether it's through religion or spirituality or a traditional faith or meditation or whatever it is, you need to, what was it, the line, oh gosh, I'll make a fool out of myself. Was it President Eisenhower that had that quote? He said, I don't care what a person's religion is as long as they have one, or something like that. Well, I'm not saying that, but perhaps when it comes to healing, to have something that allows one to connect with God or the divine or the spiritual realms and to engage that on a regular basis can help reinforce these other things, the focus and intent and compassion. So the last slide, second to last slide. There we go. So what can we conclude? Well, it seems to me, again, this was not an experimental study or, God forbid, an epidemiologic survey or anything like that. This is just the result of many years of experiencing healing and talking to healers and reading everything I could find on healers, studying them. Energy healers are a very heterogeneous lot. There are all kinds of different types, different historical lineages and categories and so on. There's not one type of thing that we can say that's energy medicine. And again, as I said earlier, there even are energy healers that wouldn't even use the word energy in what they do. Few, if any, core principles of theory or practice are common to all energy healers. Beliefs and practices are very diverse. I would, underline that and put it in italics and capital letters. I have a hard time, after all these years of engaging this field, identifying common beliefs or practices or theories or ideological aspects or things that healers do that I can say are truly universal to all energy healers. But what seems to matter are not the techniques or the ideologies, but what I've called here, it's really the attitudes and the motivations of the healers and the dynamics of the relationship between the healer and client. And this idea of a healing relationship, there's actually been a number of good papers written and studies done just in the last few years about this idea of the healing relationship. I think Wayne Jonas did some work in this area. And if you Google or do a PubMed on healing relationship, I think you'll start to find things that have accumulated over the last few years. And then finally, the last statement, because I'm a researcher, I'm a left brain number cruncher. I'm always thinking and engaging this. Okay, what are some of the good questions that we ought to be looking at? And to me, rather than the specific practices or beliefs or so on, I think empirical research would probably do best to look at the impact of again, this idea of a directed focus and loving compassion and positive intention, and whether we're looking at clinical efficacy or patient satisfaction or biomedical stuff, for me, epidemiologic outcomes. I think these are, I put it this way, these are the variables that I think we should be looking at rather than the more superficial ones that distinguish types of healers. As an epidemiologist, I can tell you that this is something that I'd probably like to do someday, to look at the impact of energy healing on population-wide rates of morbidity and mortality. And that's kind of the difference between what an epidemiologist does and an experimental scientist does. We don't really manipulate variables and look for effects on outcomes. We study whole populations over time. And I think it'd be pretty neat to identify a cohort of people that either give or have received energy healing and simply follow them over time and compare them to a group that hasn't. But over time, I mean many years, and see, are there actual differences on parameters of population health? To me, that would be very, very exciting. I think this, and also as a public health person, as an epidemiologist, to me, that would probably be the most exciting frontier for this work that I could identify. Thank you very much.